He's actually getting a little bit of referral into the front of his shoulder. Oh, it's very twitchy. Is that quite sensitive?
Yeah, it's all right.
It's okay. And how bad out of 10? What's the number?
Now 4. Used to be 7.
Was a 7 and now is a 4.
Yes.
So that has changed quite quickly. That's a really good outcome with a simple trigger point technique. So that will take a lot of tightness out of the back of this shoulder and allow this shoulder to sit in better position. Okay, so I'm just going to do a little bit more of my basic techniques, and I can feel that this is starting to mobilise already. Remember that your upper traps are really relevant to the shoulder. You do want to make sure you take care of these other global muscles that are responsible for, you know, controlling the posture and the movement around the whole shoulder girdle. So we could be talking about the rhomboids and the levator scapulae as well. Just going to work down into the lats here. So this is a lovely start position, great myofascial release type technique for working through the thoracolumbar fascia and the lats in a prone position. So this is a technique you can also do in sideline. This is a nice comfortable position for your client to be in just to start with. So I'm literally just picking up the lats and I'm intentionally working in this direction. And I can also do a little bit of really specific stripping through the fascia here, but also I can work right down into the serratus anterior at this lateral border here of the scapula. I just want to make sure my client can relax. This can be a really ticklish and sensitive area. So you just want to work, you know, just with a little bit of awareness through there and make sure that they're not guarding and they're not protecting the area. So just slowly working around the scapula, working into this tissue. This is an area around here where a lot of massage therapists actually don't focus enough. It's a very important area to help offset a lot of poor posture and neck pain and shoulder pain. So it's a really important area to make sure you're comfortable treating all through this sort of lateral and posterior area of the thorax. So I'm just following the line of the ribs. Remember the ribs sit at this sort of an angle. So I'm really just, with my thumb, I'm just working around the rib cage, feeling for areas of resistance and tightness. I'm not forcing the tissue, I'm just letting the tissue melt under my hands. You notice how often I transition back to my basic techniques. So I'm just blending those techniques. I might apply a more specific and a more uncomfortable technique, more direct technique, and then I come back to a basic technique which is a lot more soothing and integrating. Okay, so what we're going to do next, just oscillating that shoulder just to allow it to relax that little bit more. It's a nice distracting jostling, a nice distracting jostling technique just to open this shoulder, help me feel where the resistance is in the joint. So I'm just working through the biceps. It's another way you can work through the biceps. Just try and get that shoulder to stay relaxed. Just relax your arm. That's it. It's a simple way that you can actually work through the pecs with a little bit of a pin and stretch technique here. Just using the weight of the arm. just using a technique where you're just pinning with your fingers like that, levering off the table. This helps me feel where the resistance is in the pecs through the chest region. And again, just another nice little pin and stretch technique for the posterior rotator cuff. So these muscles are external rotators. So what I'm doing is I'm pinning that tissue and then I'm taking that shoulder into a little bit of internal rotation. Okay, so I'm pinning it and then I'm stretching the tissue under my thumb. Just really making sure that I'm honing into those areas where there's some specific tightness. Okay. So a little bit of myofascial release, bit of a combination technique. I'm also applying a bit of pin and stretch here, where I'm into the tissue and then applying a stretch. I'm pinning into the tissue here on the thorax and then I'm applying a stretch. Again, that technique you can do in sideline. Alright, so just propping that arm up on the table. What I'm going to do is I'm actually going to get a towel. Okay. And I'm going to prop this under the shoulder just to provide a little bit of support and to put that shoulder in a much better postural position. It's important not to be forcing the head of the humerus too far forward in the joint, because what we're actually trying to achieve here is we're trying to allow this to come backwards and offset any pain and tightness at the front. So it doesn't make sense to not be careful with this postural position and to not be doing techniques in a way that encourage this to be pushed forward. So that's why it's very important with shoulder pathology to just protect that shoulder and support the shoulder. Okay, so in this position, the lats here are nice and soft. So I can come in through here and just with a broad pinching grip, I can get my hand around the whole bulk of the lats, and then I can actually apply, I would call this it's a bit of a combination technique. There's a little bit of a myofascial release. Just trying to get my client to relax his shoulder. It's a bit uncomfortable. Probably a bit ticklish. And so I'm just slowly trying to draw that lat away from the side of the body. So I'm just trying to, in a shortened position, get access to that tissue. It's almost a little bit of a trigger point therapy technique. But it's also got a little bit of a myofascial component to it as well. Sometimes difficult to get your client to relax if they're quite ticklish. Not an easy one. You will find a lot of trigger points through this region if your client's suffering from some shoulder pain and dysfunction. Okay, so once that's nice and soft through there, can we just pause for a sec? Are you okay?
I'm really ticklish.
He's ticklish, yeah.
大丈夫です。
上手にいける。
OK です。OK です。
You might be able to notice that it keeps tightening up through his shoulder. It's because he's really ticklish.
はい。じゃあ以上です。今オーストラリアのですねスポーツマッサージの先生の YouTube を撮ってます。はい。じゃあ皆さんありがとうございます。オンラインスクールですね。できたらぜひこの続きはねオンラインスクールで見れるのでぜひ見てみてください。ありがとうございます。Thank you.
ございます。